Did you know that when your dentist puts silver tooth fillings in your mouth, they're not actually made of 100% silver? In fact, these fillings are actually an amalgam, or mixture, of silver, tin, copper, and mercury. That's why they're named amalgam fillings. More shockingly, these fillings are roughly 50% mercury by weight. You probably know that mercury is highly toxic to humans, so how does having mercury in our tooth fillings make any sense? Are our tooth fillings slowly killing us? Now, before we get into that, we first have to look at what fillings are and what they do. When the bacteria in your mouth breaks down ingested food and sugar, acid is formed as a byproduct. If you don't regularly brush and floss to remove this acid, it'll slowly break down the outermost layer of protection on our teeth, known as enamel. The process of bacterial acid wearing down our teeth is called tooth decay. During the primary stages of tooth decay, your teeth may have white or brown spots, which can be treated by regularly brushing with toothpaste that is rich in fluoride, which is a mineral that makes our teeth more resistant to acid. If you don't catch the tooth decay at its early stages, a hole might start to form in your enamel, which is called a cavity. This is where your dentist is going to have to intervene. Depending on how deep into the tooth the cavity has gone, the dentist has an array of treatment options at their disposal. From least severe to most severe, your dentist can choose from having to do a filling, a crown, a root canal, or a full tooth extraction. Today, we're going to focus on fillings, the most basic treatment for early stage cavities. The purpose of a filling is to restore missing tooth structure that a cavity may have caused. To perform a filling, your dentist will first numb your tooth with a local anesthetic so that they can remove any decaying tissue with minimal discomfort. Next, they will fill the hole with their filling of choice and finish it off by polishing and smoothing the filling for comfort. So now that we know what fillings are and what they do, we're going to talk about the historically most common dental filling, the amalgam filling, which we now know actually contains 50% mercury. Amalgam fillings have been used for 150 years due to its relatively low cost and high durability compared to other restorative materials. Additionally, the specific mixture of silver, tin, copper, and mercury has two very unique properties. Firstly, it's what we call bacteriostatic, meaning that it prevents bacteria from multiplying. Secondly, these fillings are self-sealing. Any space created between the tooth and the filling is slowly closed by the corrosion of the metal. This prevents bacteria from invading and multiplying within the filled location. While silver amalgam fillings have been the gold standard for the past 150 years, their popularity has recently decreased due to its unappealing appearance, as well as health and environmental concerns regarding the use of mercury. Now, the question we've been waiting for: does mercury from our amalgam fillings actually leach out into our body? The answer is yes. Autopsy studies have shown that individuals with amalgam fillings have 2 to 12 times the mercury in their tissues than those without. The highest intake of mercury occurs during the filling's insertion and removal, where mercury vapor that is being released from the filling is then absorbed by our lungs. Additionally, smaller amounts of mercury are ingested through everyday wear and tear that occurs during eating, grinding, or brushing. Like I've mentioned, mercury has been used in amalgam fillings for 150 years, which means that there's been extensive research surrounding whether the mercury is harmful or not. For example, research has shown that amalgam fillings in pregnant mothers are not associated with negative birth results. They're also not associated with adverse behavioral or kidney effects in children. And lastly, the estimated mercury absorbed per day from these fillings was 3 micrograms to 7.4 micrograms, which is far below the acceptable dose of 30 micrograms per day created by the World Health Organization. So while scientists agree that amalgam tooth fillings leach mercury into our bodies, the majority of them also agree that it does not lead to health issues in the general population. However, there are a select few who still believe that amalgam filling should be abandoned for less toxic materials, especially in children and pregnant women, to avoid mercury interfering with brain development. If this information has you reconsidering what type of filling you want, there are other materials that can be used instead of amalgam for fillings. The runner-up being composite resin, which is a very strong polymer that blends naturally with the tooth's color. However, these fillings also have drawbacks. For example, these fillings are twice as likely to fail and are worse at preventing recurring cavities. As well, composite resin fillings leach bisphenol. With composite resin being the newer material, further studies are needed to assess the health effects of bisphenol in composite resin fillings. So that brings us to the end of the video. At the start, we talked about what fillings are and why they're used. Next, we talked specifically about amalgam fillings and how even though they contain mercury, the majority of evidence shows that they do not cause adverse health effects. Lastly, we wrapped up by talking about a new filling material, composite resin, and how it too has its drawbacks. I hope this video helps you make a more informed choice next time you're at a dentist for a filling. Feel free to check out the articles below.